Hi everybody, welcome to Vijayaserve Foundation. My name is Manoj Swaminathan and today we are going to learn about 4 minimum criteria and the case report validity. It's a very important concept and it's also one of the most commonest questions asked during a pharmacovigilance interview. And if you are a fresher, you necessarily need to know about 4 minimum criteria and also about the case report validity. Now let's start learning about this. Why do you want to demarcate these two terms, right? Validity and invalidity, right? Why do you want to demarcate or distinguish between valid and invalid cases? This is because only the valid case reports are reportable and the invalid case reports are not reportable. By reportable, I mean to say that I'm talking about submissions to the regulatory agencies. So that is the most important difference between a valid and an invalid case report. What are the 4 minimum criteria or the 4 criteria for an adverse event? And if the 4 criteria are available, only then a case report is considered to be valid. The first criteria is the reported adverse event, right? So when we are talking about pharmacovigilance, it is obviously an adverse event. So we need to know about the reported adverse event. The next criteria is the suspected drug or product, right? So if you're talking about an adverse event or a side effect, you need to have a medicine and also the side effect. So the second criteria is the suspected drug or product. The third is identifiable reporter, right? The person who reported the adverse event to the pharmaceutical company. And finally, the identifiable patient. So this is the person who experienced the adverse event or the side effect, right? So these are the 4 minimum criteria for adverse event. Now let us learn about each of these criteria in detail. Let us first learn about the identifiable patient. A patient can be identified by various means. First and foremost, the name or the initials, right? Everybody is identified by their name. So if somebody doesn't want to report their name, they can even provide their initials. So this is one of the commonest identifiable criteria. Second is the age or age group. There are some people who are shy of sharing their age. So in that case, they may provide their age group. So that is a possibility. If I, I were to give an example of age group, so that will be something like an elderly or a middle-aged man or a child, right? Pediatric age group, right? So age group is also okay in terms of validity of the or the identifiability of the patient. The next is date of birth. Very rarely you would find the date of birth of the patient who has experienced the adverse event. But then if it is available, it is very useful, right? Then comes the gender. It can be male, female, or others. So recently, many agencies have started including this in their forms, others, right? So in the past, it used to be only male or female. But then most often, the gender is not available, right? So then you can select unknown, okay? Then the ID report or the say identifying number, right? It can be uh, an Aadhaar number, a PAN number, or a social security number, but that can be confidential, so you don't need to use that. But then when you talk about ID, it is generally an identifiable number like say patient number 5, right? So that can also be an identification number. Then email, right? Very rarely you also can get only email address and you wouldn't get any other information. So email may be considered as a identifiable information for a patient. So there are people who would say disagree with this, but then if you don't have anything else and you have the email address, so at times you can consider that as a validity criteria or identifiability criteria. So what is going to be in the future? In the future, we are going to have biometrics, right? So these are going to take over all the other identifiability criteria. And with the advancement of blockchain technologies and so on, so in future we would have all sort of new identifiable categories for the patients. Now this is very important. Only one identifier is also okay. You may think that okay, I have the age, I also need the gender. No, if you have the gender not the age, still okay. If you have the age but not the gender, okay. If you have only the date of birth, even that is okay. And if not anything and you only have the age group, even that is okay. So if you only know that the patient is a senior citizen or an elderly and you don't know anything else, even that is more than enough for identifying the patient. Okay. Now let us learn about the identifiable reporter. So who is the reporter? This is the person who communicates the adverse event to the pharmaceutical company or the partner or the service provider of the pharmaceutical company. So how do you identify a reporter? It's in the same way, right? So it can be somebody who is a physician or somebody who is a nurse or say pharmacist, or it can be the patient himself or herself or the patient's caretaker, family members. It can be anybody, right? So this is also important. Sometimes the reporter and the patient is also the same, right? So that is when the patient reports, the patient becomes the reporter as well as the patient, right? Then comes the suspected drug or product. Very important. If you don't know the medicine name, then what is the use of having the adverse event report? So very, very important that you should know which medicine may have caused the adverse event. Okay. So this is very straightforward. You need the name of the medicine. If you don't have the trade name, only the generic name, that is okay. At times, you may even get the batch number or the lot number along with the expiry date. So if you get that information, well and good. Or else you can follow up and ask for more information. Okay. Then comes the reported adverse event. That is the side effect that the patient has experienced. So that is very important. It can be anything that the patient says that he has fever or has developed a rash, headache, say loose motions, right? It can be anything, body pain, it can be anything, right? So adverse event, that's the side effect. It can be one or many. Somebody would report only one, that okay, I have got fever, or somebody would say I have got fever with body pain with chills. So that is also a possibility. So it can be any number of adverse events. Then social media, right? So social media is also a very, very important or common source of adverse event. So that's something you should remember. And nowadays a patient would post something on Facebook or Instagram or Twitter before communicating to their family members or to the physician or the healthcare professionals. So anything can happen. So uh, social media can be an important source of adverse event. These are generally invalid case reports that you wouldn't have information about the patient or the reporter. But then, if you try to follow up and get information, it will be very useful because you get a lot number of case reports from social media. Now, invalidity of the case reports, right? So, if you don't have any of the four minimum criteria, then the case report is considered to be invalid, right? So you have four minimum criteria, case report becomes valid. If you have only three, then the case reports become invalid, right? So that is very important. And if you don't have any of the minimum criteria, then what you are supposed to do, you need to follow up, right? You need to check with the reporter and say that, hey, you have not provided this information, I would like to know this. For example, a physician reported that one of my patients had a rash. So you go back to the doctor and ask that the who is the patient who experienced the rash, and the doctor would say, okay, a 74-year-old male. So that way you can get information once you follow up. Then invalid case reports can also be used for signal management. So imagine you have just the information about the medicine name and the side effect, and you don't have the identification criteria for the patient. Okay, so still it may help during signal management. So what do you mean by signal? It is something where rather give you an example of the COVID vaccine. Say you have say 100 patients who had taken COVID vaccine, and say 40 of them had loose motions, or that's again that may be expected, may not be a signal. But then if I say that 40 of them had myocardial infarction or a heart attack, so that may be a signal, right? So uh, even if you don't have the patient identification data, still the case report can be, or the invalid case report will still be of some value in signal management. Now, what we will do is we will learn with examples. Okay, I have something like 5 examples, and let's think over these examples. And some of them can be quite tricky, and that is the way it works in the pharmacovigilance field. Okay, let's look at the first example. Dr. Jim called up the company A and informed that one of his patients developed a rash after she was administered A insulin. Now, who is the reporter here? It is Dr. Jim. Then, which is the medicine or the suspected drug? It is A insulin. Okay, you have that also information. Then, what is the adverse event here? It is rash. Now, if I ask you, do you have information about the patient identifier? Can you think about it? So, here is the catch. After she was administered A insulin, right? So, that means the patient is a female. So this is how you need to identify. Okay, so this is a very good example. So here the identifying criteria is the gender, right? So the patient is a female. Now let us look at another interesting example. Dr. John mentioned that one of his patients developed a cardiac arrest after administering the COVID-19 vaccine. Now, what is the drug here? It is COVID-19 vaccine. And who is the reporter here? That is Dr. John. And what is the adverse event here? It is cardiac arrest. But what is the, I would say, the identifying criteria for the patient? So you might get confused because it is one of his patients. No, it is Dr. John's patients. So his is there. So here you don't have information about the patient, right? So the identification criteria is not available. So this becomes an invalid case report. What you need to do? You need to now call up Dr. John and ask him that you have reported this case report. So your patient is a male or a female. Can you provide more information? You may get the information or you may not get the information. So that way it will work. Okay. Now, as I told you, that invalid case reports can help in signal management. So here is a classic example. You know the name of the drug, and you also know the name of the medicine. Sorry, name. You also know the adverse event. So you have both the information. So this can be used in signal management. And if it is a trivial adverse event, for example, say injection site pain, injection site rash, or say fever, so that these events may not be of so much of importance. But if you have a rare adverse event, say stroke, or something like a blindness, right? So these can be very rare and very useful as well. Okay. So now let us look at the third example. So this is something which we obtained from Twitter. So this was actually reported. Okay, it's a screenshot from Twitter, and I'll read it out. Dennis Grady is the person who has posted this. Days after he got Pfizer's COVID vaccine, a serious blood disorder set in. 2 weeks later, he died from a brain hemorrhage related to the vaccine. question mark. His death is being investigated. So this was reported in Jan 2021, okay, long back. Now, what information do you have? You have the information about the drug. Yes, it's the Pfizer's COVID vaccine. How about the reporter? Yes, you have Dennis Grady who has tweeted this. Then how about the uh, adverse event? So adverse event is brain hemorrhage, blood disorder, the serious blood disorder, and death may be considered an event, but more often death is considered as an outcome. Okay, so these are the adverse events. Now, how about the patient's identification criteria? Right. So it is he died from. So he becomes male. Right. His death is being. So the patient is a male. Okay. A female has reported, and she is talking about a male. So this is again a valid case report from Twitter. Right. A valid social media case report. Now let us look at the fourth example. Dr. Marshall reported that two of his lactating patients developed feet swelling after starting on paracetamol 650 milligram tablets. One of them recovered after stopping the medicine. Very interesting, tricky scenario, right? Now, two of his lactating patients. So that's something which might give you some idea. So, what is the suspected drug here? It is paracetamol 650 milligram. And what is the adverse event here? It is feet swelling. And who is the reporter here? Dr. Marshall. How about the patient? Patient is female. Why? Lactating. So if the patient is lactating, then it is quite obvious that the patient is a female. So you now have two case reports. Now you will tell me that there are two patients, but the data is same. No. If you look at the last sentence, one of them recovered after stopping the medicine. So one of the patients, the outcome is resolved. Other patient, the outcome is unknown. So two case reports. In one, outcome is unknown, and in one, the outcome is resolved. Right. So this is very interesting case that you will be able to create two case reports in your database. Right. Now let us look at one more example, the last one. Dr. Alina informed that one of her patients developed prostate cancer while on tablet allelosy for the renal ailment. So it's an hypothetical drug name, okay, not a real one. Now, you know that the prostate gland is found only in males. Now, you would argue that there are cases where females have been found to have the prostate gland. Yeah, there can be exceptional scenarios. I'm not denying that. But very likely that the patient is a male. So, who is the reporter here? Dr. Alina. Drug, tablet allelosy. What is the adverse event here? Prostate cancer. Okay? And the indication is renal ailment. So, that is not one of the four minimum criteria, but then just telling you. And how about the identification criteria? It is a male patient. So, that is what you need to assume. Right? So, again, this is also a valid case report. Okay? So, what we have seen? We have seen 5 examples, the real life scenario, right? And based on that, you need to identify whether a case report is valid or invalid. Again, validity is a very important uh, concept in pharmacovigilance, and more so is the four minimum criteria. So if you have four minimum criteria, that becomes a valid case report, right? And the day you come to know about the four minimum criteria, that becomes the day zero, right? Day zero. So that is the initial receipt date of the adverse event. I trust you found this session to be useful. Feel free to reach out if you have any questions, comments, or even suggestions. Thank you and all the best.